Hello there, this is John, and this is Chapter 9 Lifespan Development. So, first and foremost, a newborn child is called a neonate, and any child who's less than 28 days of life is considered a neonate. One thing about these kids is we rarely see them in the pre hospital environment. The only time we actually see neonates or we get calls for neonates is either they probably have sepsis or they have some kind of congenital defect of their heart or even their gastrointestinal tract. Or sometimes the parents just have a, some kind of mental meltdown and they call 911. So I understand that completely. You'll notice if you're looking at the vital signs at the bottom of the page, their heart rate's really fast, the respiratory rate's really fast, the blood pressure's really low. Think about it this way. So their heart rate's really fast because their heart's really tiny. They have very low blood volume. I think the entire child that you see in the picture right there probably has about 16 ounces of blood in their entire body. So they got to pump blood really, really fast to move things around to get things circulating. And of course, they're breathing really fast because the lungs are immature and they got to breathe really fast to make up that volume, oxygen uptake, and all that. And of course, as this child matures, these numbers will actually, the heart rate and the respiratory rate will start to slow down and the blood pressure will start to rise as the patient's blood volume increases. Now, the average healthy full term infant usually comes out around 7, 8, or 9 pounds or so, somewhere in that neighborhood. The ones we're really concerned about are the premature births, the children that are born less than 38 weeks of gestation. And these kids can come out 3 pounds, 4 pounds, and they're really not entirely prepared to survive out in the environment. So we, as pre-hospital providers, are going to have to help this child, keep them warm. Do not let them become hypothermic. Maybe some bag valve mask ventilation, some oxygen of some type, maybe even some chest compressions possibly to keep them going until that we can get them to the hospital to where they can be treated by physicians. Now, when it comes to the respiratory system, the pulmonary system, predominantly these kids are nose breathers. I'm talking about infants, toddlers. They breathe through their nose. They're also belly breathers. I don't know if you've noticed this before, but if you look at a little kid and 1 years old, 2 years old, they're sitting there playing with their blocks or whatever they're doing, watch their tummy. Their tummy actually rises and falls. The chest doesn't because the intercostal muscles, the rib cage, all that's really immature. And the biggest muscle they have is the diaphragm to help them breathe. So they breathe with their diaphragm. So they're belly breathers, which is totally normal. I'm sure some of you probably have dogs or cats, and you dog or cat probably at some point got sick with a cold. You might have noticed that your animal was really looking like it was in major distress. It was breathing through its mouth. And the reason why the dog or the cat looked like they were in so much distress was because they're not used to breathing through their mouth and they start panting. Same thing with little kids, little infants, 1 year old, 2 year old, even 3 year olds. When their noses get full of mucus and gunk, they have to breathe through their mouth, which is abnormal for them. And they start to pant and they start to have problems breathing. And you might get called for this. This little kid, little 1 year old, looks like they're panting away, mouth breathing. And if you just suction their nose with a little bulb syringe and take out the gunk, whatever's in there, it reduces their discomfort dramatically. Now, immune system, the little kid, they get some of the immunity from the mother while in the womb and through the mother's milk as well. It doesn't last that long, a few months from what I understand. But of course, where you build your immune system is by just getting sick. So this little kid has to go out into the world, meet other little kids, get coughed on, and they develop this, immune system. But it does mean that because they have this immature immune system, they are prone to infections. So that's why you see these little kids sometimes, it's rare, but they do get sepsis or other types of serious bacterial or viral infections. Their nervous system, their central nervous system is also can be flipped. And exactly when this flips back the right direction, I can't really tell you. But at least for the first few weeks of life, their nervous system is flipped to the point where if you think about this, if you or I or even an older child became hypoxic for some reason, one of the very initial things that your body does is it sends out messages to increase your heart rate to compensate for the hypoxia. So you become tachycardic. These little kids, these little neonates, because their whole system's flipped, at least temporarily, when they become hypoxic, they become bradycardic. Their heart rate drops dramatically, and they can die from this. That's why it's so important for us to make sure that they are, properly ventilating and they're getting oxygenation. And if they're not, then we need to assist them. Now, the skull cap is made up of a number of different bones or plates. When you get pushed through your mother's birth canal and you have to go through the pubic bone and out into the real world, your head actually has to deform. Like you see in the picture, this kid looks like he's like some kind of speed racer or something. When the baby comes out, their heads are slightly deformed because those fontanelles are actually, or those bones are not connected yet. They're loose, and there's fontanelles, there's gaps between these bone plates to allow that head to deform slightly, and then you get out of your mother's womb. Over time, and I don't know exactly how long, I know it's months, those fontanelles do resolve and the bones fuse together, obviously, because your head's pretty solid. But keep that in mind. Now, normally these gaps between these plates, the fontanelles are normally flat. If the fontanelles are bulging, that means there's increased intracranial pressure inside the child's brain pan or their cranial vault. If they're sunken, it might mean that the child is dehydrated. So the fontanelles actually play a pretty good role in assessing an infant, at least up to about 6 or 8 months or so. Now, as once the child gets to about 4, maybe 5 months or so, they've now bonded with their parents. They do get separation anxiety, meaning that if mom calls 911 and you show up in your little uniform and mom hands you, to the paramedic or EMT, you're going to freak out. So if the child is awake, active, and acting somewhat appropriate, more than likely they will feel separation anxiety from their parents, and they'll start crying and screaming and having a bad time. So yelling and screaming and crying is actually a really good thing, because one of two things. One, the infant or the child's aware of what's going on in some respect, and on top of that, they got lots of air in their lungs, which means they're breathing just fine. The kids that worry me are the ones that aren't crying, the ones that are crying weakly, or the ones that really aren't responding appropriately for their development. And of course, the parents will probably be there. Hopefully they'll be there. You're definitely involve the parents in the process. Have the parent take off the child's clothes. Have the parent hold the child. Whatever is appropriate based on the patient's condition and how well the parents deal with the situation. Now, obviously, if the 6-month-old baby's in cardiac arrest, you probably don't want mom holding her. Makes sense. So over the first 12 months of life, there's just this exponential, change in this tiny little thing's life. They're able to walk now. They're probably tottering around a little bit on their little legs with some kind of assistance. They might even be able to say mama or papa. They're going to hold sippy cups. They might be able to put things in their mouth. In fact, more than likely, they probably will put things in their mouth. That's what the kids do. So they develop dramatically by this time, by the end of that 12-month period. But remember, up to 12 months, they're still infants. So you can see what's happening to their breathing. Breathing is slowing down. They're still nose breathers. Their heart rates are slowing down because the heart's getting bigger and there's more blood volume now. So now you're seeing a higher blood pressure as well. Now, from 12 months to 36 months, this is the toddler age. They're toddling around. Um, these kids are difficult to deal with. So the parents probably will not have control over this child. You're going to have to become the parent, and you're going to have to control this kid. Everything out of this kid's mouth is no, 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 and no. So don't give them any choices. Don't go walk up to a 2-year-old. Go, hi, little Bobby. Would you like the IV in the left arm or the right arm? It's like, no, it doesn't work that way. It's just these kids. They're really nasty little things. They're, like it says here, they're moody, they're violent, they're sullen. They're really not happy people to deal with. So if you encounter a toddler, a child that's 2 or 3 years of age, and they're you know not responding well to you, they're acting sleepy, or they're not responding in their normal way, I'd be worried about that child. Something's seriously going on with this kid. Again, you'll notice what's happening to the vital signs. Things are starting to stabilize a little bit. Heart rate's going down, breathing's kind of going down, BP's going up, and you'll notice the temperature. The temperature's normally on an infant or a young child, temperature, because their metabolism is so fast, you're going to get slightly higher body temperatures. So 99, 100 is not abnormal for an infant or a toddler. That's not a fever for them. That's their normal body temperature. You get into now you're talking about the 3, 4, 5-year-old. This is the preschool little kids. They're actually can be somewhat what's the word for it? They can be somewhat inquisitive about what you're doing while you're there. They're starting to develop social interactions and all that. But unfortunately, this little 4 or 5-year-old girl, she falls off this jungle gym, breaks her leg. The pain and the emotional response to all this might make her regress emotionally back to a 2-year-old. So she might get sullen and angry and say no as well. So then you have to rethink how you're approaching this 5-year-old and treat this 5-year-old like a 2-year-old because of the way they're presenting themselves. School age kids. So now we're talking about 8, 9, 10, maybe 11 years old. The one thing about these kids is, I don't know whether it's social media or whether it's a sign of our society gradually falling apart, but I've found over the last 10 years, I'm seeing more and more kids, 10, 11, 12-year-old kids who are overdosing on drugs, who are having, either pregnant or they have some kind of disease from sex. These kids are like 10, 11, 12 years old, and they're having sex, and they're taking drugs, and they're drinking alcohol. Something that we would normally associate with teenagers, we're seeing now in preteens. So now you're dealing with that situation as well. Remember too that these kids are building relationships with other kids, and they're starting to understand about things like death and injury and life and all that stuff. And sometimes, if they're stable and all that, they're curious about what we do, and they ask you questions. What does a siren sound like? Or why are you doing that? And those kinds of questions. Just answer them in simple terms. Be pleasant. The teen years, of course, obviously, we were all teenagers at some point. We'll understand probably the teenage years. Teenagers are really hard to deal with in most cases when we're dealing with, talking to them and interviewing them, especially if it's anything related to drugs, alcohol, or reproductive issues. A big issue with that. Talking to them, especially if the parents are nearby or within earshot. But they go through a lot of problems. They go through all different kinds of emotional, and there's obviously they go through puberty and all that terrible stuff that you have to go through. And primarily, the biggest reason we get called out for teenagers is usually trauma. because kids just don't understand. They've never really been hurt, and they think they're Superman, and they do crazy things and they get hurt. Um, but pretty much it's going to be trauma, or it's going to be kind of drug related. There's a lot of suicides at this age as well, or suicide attempts anyway at this age as well, due to the depression. When it comes to adults, and we're going to skip over young adults because physiologically nothing's really changes. Everything's been stabilized at this point. Younger adults, 20 to maybe 40 or something along those ranges, they usually don't have any medical problems to speak of. Their blood pressure, vital signs are all stable. They're probably not on any medications, because there's some exceptions to that. But on the average, they're not really very interesting for us unless they crash their car. But this middle adulthood, we're talking about the people in their 50s and like that. There are some changes now. Now you're starting to see chronic illnesses, maybe type 2 diabetes, maybe heart conditions, hypertension, cholesterol issues going on. Now they're start thinking about making different medications, and they're also dealing with, now they are probably grandparents, or they could be grandparents by this time. So now they're dealing with now not just their children, but also their children's children as well. Maybe they've taken over the young child's care because the two parents are at work, which puts stress on them. So here's this middle adult. Vital signs are still fairly stable, but again, you might have those medical concerns or problems. Now, late adulthood, this will be the geriatric period. So, 61 it says here and older. So I think your book says 65 and older. But now you're dealing with people in their 60s, 70s, 80s, even up to 100 years of age. I've had patients up to 104 years of age. So you can see where there's major physiological changes happening in the aging process. Your heart rate increases again, back up again, because your heart's not as efficient or as effective as it was when you were younger. Your lungs are less pliable. Your intercostal muscles, your cartilage in your rib cage and all that are less pliable. So you have to breathe a little faster to make up for tidal volume. Your blood pressure goes up because you have hardening in the arteries and plaque development. So there's all these things that we start having. Now, people live into their 90s routinely now because of all our great medical care, but they have these chronic conditions and they take lots and lots of medications. So polypharmacy is a big problem, and I'm sure that when you guys go out into your hospital clinical time and your ambulance clinical time, you'll transport or you'll interact with geriatric patients, and I guarantee that they're going to have a freaking shoebox full of medications. They're going to hand you a whole bag of medications. Take these medications. They take a lot of medications, and believe it or not, a lot of times these people have no idea what the medications are for. In fact, I even challenge you to in a nice way, ask the patient, I notice, ma'am, you take metformin. Do you know what that's for? Or, just pick one of the medications out of the bag and go, what do you take this for? I guarantee that a lot of them will not know what it's for. And so there's a lot of issues with overdosing, mixing medications, this synergetic effect of different medications working against each other or with each other. Life expectancy is very high now, like I mentioned, like sometimes up to 100 sometimes. There are some limitations to this. What I've read is that if you have a married couple and one of the spouses dies, within a year, the second spouse dies. It's pretty routine. So this loss of the one spouse leads to the loss of the other. When it comes to trauma, you have a older person in their 70s or 80s or 90s they fall and break their hip, or they break their femur, or they have some kind of, serious traumatic injury, they have about a 1 year life expectancy. And they don't die from the actual injury. They actually die from secondary infections caused by their bed rest or caused by their hospitalization. Cardiovascular, we talked about this. Heart cardiac output decreases. They get arrhythmias, primarily atrial fibrillation. Their BP increases. Their nervous system, their brain shrinks. They could possibly get dementia or Alzheimer's. But even if you don't get that, your brain still shrinks. And so if you shrink the brain inside the cranial vault and you fall and hit your head, there's a much greater chance of that brain sloshing around, tearing or rupturing blood vessels, leading to serious injury or even death. And of course, because they do fall, there's balance issues, there's vision issues along with this as well. Most people in their 60s, 70s, and 80s have some form of neuropathy. This could be a numbing sensation to their extremities. It could be a tingling, a very painful tingling sensation to their extremities. Everyone has a different kind of sensation or feeling with neuropathy, but the nerves are damaged from the aging process, and they might not be able to feel their feet. So when they're walking, one of the ways that we're able to keep our balance is we can feel the ground underneath our feet, and it helps us keep our balance. So they have that issue there. They can also lose, their appetite, their loss of taste or smell. So food doesn't taste good to them, doesn't smell good to them. So they eat less. They become obviously malnourished. And the renal system, the kidneys, because they're reduced output, they can get dehydration issues with this. They don't drink enough water. They don't get enough output. And of course, it's unfortunate about that. Isolation is another big issue. I mean, imagine if you're 96 years old and all of your friends and all of your family have died, and you have no more friends to talk to. You've outlived them all. It's very, very depressing. Mobility issues, of course. Not everyone in their who's elderly has mobility issues. Some need walkers, some need wheelchairs, some don't. But think about mobility out of your house. I mean, you're in your house, you want to go to the store, you want to go to the movies, you want to go to the senior center, that's mobility as well. So a lot of seniors don't get a chance to get out. They get very depressed, unfortunately. When it comes to loss of independence, if they do live by themselves and they're able to care for themselves and they're able to get around and feed themselves and they're independent, they really don't want to go to the hospital because they associate the hospital and physicians with, trying to keep them at the hospital, and they lose their independent life. And of course, when it comes to financial, they also are prone to scams and people stealing from them, and they could lose their savings by getting scammed by somebody. And also a lot of them are on fixed incomes. I mean, some of these people live on less than like $1,000 a month. Some of these really, really poor elderly people, and they depend heavily upon charity and social support programs. So I think we're done with chapter 9.